being able to explain the concept of body composition to your clients will allow them to understand the difference between their weight on a scale and the percentage of body fat that they may possess. This knowledge can lead to more appropriate discussions on health risk and goal setting. Therefore, in this video, we will be discussing the components of body composition, examining the pros and cons of different body composition analysis techniques, and finally, we will demonstrate the proper way to perform a skin fold assessment. Let's start with the components of body composition. Body composition is described as the relative proportions of lean and fat tissues within the body. Lean body mass is composed of muscles, connective tissue, bones, blood, nervous tissue, skin, and organs. For the most part, lean mass is metabolically active tissue that allows the body to perform work. As you've read in your textbook, a certain amount of body fat is necessary for insulation and thermoregulation, hormone production, cushioning of vital organs, and the maintenance of certain body functions. This type of fat is called essential body fat. For men, essential fat ranges between 2 and 5%, while it is between 10 and 13% for women due to hormonal functions. The remainder of body fat is stored throughout the body in adipose tissue, either under the skin called subcutaneous fat or as visceral fat, which is inside the body cavity surrounding the visceral organs. Visceral fat is also known as active fat, as it influences how hormones function in the body. An excess of visceral fat can therefore have potentially dangerous health consequences. There are quite a few different methods for analyzing body composition, each with their own set of pros and cons. Prior to discussing these techniques, keep in mind that some clients are very eager to know about their body composition, and the results may be helpful in setting goals. However, not all clients are interested in the results, or they may even be demotivated by the results. Therefore, understanding your client's comfort level with the assessment will allow you to determine if body composition should be assessed. In addition, if a client has extreme obesity, some of the body composition assessment techniques will be inaccurate and contraindicated. In such cases, it may be more appropriate to utilize only BMI and circumference measurements if your client is comfortable with those measures. Dual energy X-ray absorptiometry, or DEXA, has become a common measurement of human body composition in research. DEXA uses an enhanced form of X-ray technology to measure body composition. It is one of the most precise and comprehensive methods available. However, it is expensive, and depending on where you live, the tester may need a radiology license to perform the scan. Hydrostatic weighing, or underwater weighing, is also another common method for measuring body composition. It measures a person's total body density and requires a tank of water in which the client can be submerged as the amount of water displaced is measured. And then, through a series of mathematical equations, body composition can be determined. This method is very accurate. However, due to the water tank, it may not be practical for most fitness professionals. In addition, if your client is uncomfortable being underwater, the results may not be accurate. Another method similar to underwater weighing is air displacement plasmography. To analyze body composition, the client sits inside a small chamber which measures the amount of air that is displaced. This method is great for individuals who have mobility issues, but not so great for individuals who are claustrophobic. Bioelectrical impedance analysis is a common method found within fitness facilities, as it is relatively accurate and the equipment is portable and inexpensive. Bioelectrical impedance runs a weak current of electricity through the body to estimate body composition. Bioelectrical impedance analysis determines the resistance to the flow of current as it passes through the body. It provides estimates of body water from which body fat is calculated. Fat has a lower water content than muscle or connective tissue. Therefore, more fat will slow down or impede the electrical current. There are quite a few factors that can negatively affect the results of this method, such as skin thickness on the palms if the device is handheld, hydration level, ambient and skin temperatures, exercise or alcohol consumption within 24 hours prior to the test, as well as the use of diuretics or specific medications. Finally, let's discuss skin fold measurements. This technique uses calipers to measure the thickness of the area of the skin fold. The areas selected for measurement are sex-specific, as fat is stored differently in males and females. The recorded data is entered into a specific formula, which in turn produces a calculated body fat percentage. The skin fold measurement technique is based on the assumption that 50% of body fat rests under the skin. This method has been shown to be fairly accurate once the tester is proficient in the protocol. In addition, the equipment is mobile and reasonably priced. However, skin fold measurements are not an optimal or even an appropriate choice for clients with obesity, as accuracy decreases with increasing body fat, as the assessment cannot measure visceral fat. There are several protocols for skin fold measurements, as well as several types of calipers. Let's look at the different types of calipers first. Here we have plastic, Lang, and Harpenden calipers. The plastic calipers, while excellent for teaching large groups of fitness professionals how to measure skin folds, are not as accurate as the Lang or Harpenden. As skin fold measurements are already an estimate of body composition, using substandard equipment may further compromise results. The Lang and Harpenden calipers are similar in design. However, the Lang only has a range of 60 millimeters, while the Harpenden has a measurement range of 80 millimeters. In other words, the mouth of the calipers open wider with the Harpenden. In addition, the Lang has been shown to produce higher body composition readings than the Harpenden. In other words, your client's body composition reading may be inaccurately higher than when using the Harpenden calipers. There are a few guidelines to keep in mind when performing skin fold measurements. First, much like taking blood pressure, this is a skill that takes practice to become proficient. It takes a minimum of performing about 50 assessments to become skilled at this technique. After establishing with your client that skin fold measurements are appropriate, be sure to explain to your client how you will take the skin fold so that he or she understands the process and knows what to expect. To take skin fold measurements, be sure to assess your client in a private area. You will need to take measurements on the skin directly, which will require your client to remove or lift up some clothing. You will want to maintain a professional and confidential environment. Be sure to ask your client's permission prior to taking skin fold measurements. All measurements are taken on the right side of the body. You will grasp the skin fold firmly with the thumb and index finger of the left hand and pull the fat fold away from the muscle. Remember, you are trying to grasp just the subcutaneous fat. If you have hold of the muscle as well as the fat tissue, your measurements will be higher and therefore inaccurate. Hold the calipers in the right hand perpendicular to the site. Place the pads of the calipers approximately 1/4 inch from the left thumb and forefinger. Read the dial to the nearest 0.5 millimeter, approximately 1 to 2 seconds after releasing the trigger. Keep hold of the skin fold. Take a minimum of 2 measurements at each site. Measure each site once and then go through the process again. Accuracy is important. You must obtain 2 measurements which vary by no more than 1 millimeter at each site. If not, you must retest that site. And finally, you need to decide on the number of sites you will be measuring. Protocols call for 3, 4, 7, or 9 sites to be measured. We will be demonstrating a 3-site protocol. The anatomical locations differ between males and females. Let's start with measuring a male. The first site will be the chest. This is a diagonal skin fold taken halfway between the anterior axillary line or crease of the underarm and the nipple. Using a measuring tape, measure the halfway point and mark it with an X. Grasp the skin fold. The second site is at the abdomen. It is a vertical skin fold taken 1 inch lateral to the umbilicus. Again, make sure to separate the fat from the muscle for your reading. And finally, let's measure the mid-thigh. This is a vertical skin fold taken midway between the greater trochanter of the femur and the patella on the front of the thigh. Measure the site and mark it with an X. Next, have your client raise the right heel off the ground, placing the weight on the left leg prior to grasping the skin fold. The measurement sites for females are slightly different due to the distribution of adipose tissue. The first site is the triceps. It is a vertical fold on the back of the upper arm taken halfway between the acromion and the olecranon processes. Again, measure your site prior to grasping for the skin fold. Let's move on to the suprailium. This is a diagonal fold taken at or just anterior to the crest of the ilium. And finally, the mid-thigh. This measurement is taken the same way as a male client's mid-thigh location. Grasp the skin fold halfway between the greater trochanter of the femur and the patella on the front of the thigh. Once you have taken a minimum of 2 measurements per site that are within 1 millimeter of each other, you can use the body fat percentage calculator on ACE's website to determine the percentage of body fat. The calculated body fat percentage is used to determine the percentile rank into which your client falls. If you look at the table in your book, you can see that your male client, who is 43 years old, with a body fat percentage of 25%, falls into the 30th percentile. This means that his body composition corresponds to about 30% of the population in his age range. You now can use this information to establish goals with your client. In this video, we discussed the components of body composition, which are lean mass and fat mass. In addition, you learned about essential fat, which is necessary for physiological functioning, as well as adipose tissue, which is found subcutaneously or viscerally. Next, we examined the pros and cons of different body composition analysis techniques, such as DEXA, underwater weighing, air displacement plasmography, bioelectrical impedance, and skin fold measurements. And finally, we demonstrated how to correctly perform skin fold measurements. Becoming proficient at body composition analysis will allow you to confidently provide your client with the information on the ratio of lean mass to fat mass and health risk index. It will also allow you to collaborate with your client to set appropriate goals. Remember, not all clients may benefit from a skin fold measurement.